Hi, I'm Chloe Gummer, and for the final course project, I made a trauma center resource optimization and pre-hospital risk stratification bot. Uh, so an overview of this bot is that it's a bot for trauma centers. Basically, it determines the EMTs use it to determine what trauma level the patient is at and whether or not they need to be admitted to the trauma unit. So the benefits of this bot are it improves accuracy, it reduces human error, it has better patient outcomes, and it has a more efficient use of resources. Some of the challenges are that it has high implementation costs. We need to have great system reliability and adoption resistance from the personnel. Some feature enhancements of this bot are focusing on expanding its predictive analytics capabilities. So an introduction to this bot is that the current issue I base it off of is that the reliance on paramedics' judgments sometimes lead to inconsistencies. So sometimes they may over-triage a patient, and this is when they state them as a higher trauma level than they really are. And this wastes hospital resources and hospitals' money. Or sometimes they may under-triage a patient, so they put them at a lower level of care than what they really need, and this can affect the patient's outcome and overall care. So my proposed solution is, this triage decision-making bot. And for this project, I collaborated with Dr. Danielle Cummins. She is from the IU School of Medicine. So the business domain standpoint is that it's good for cost efficiency. By reducing like unnecessary trauma activations, you save money on the resources for the patients that don't really need the resources. You enhance hospital efficiency. So if you have like a big trauma unit full of patients, some of them may or may not need trauma level care. By eliminating the ones that don't really need that high level of care, you allow the hospital staff to focus on, the ones that are in critical condition. And it also leads to a standardized approach of like decision making across, different agencies and hospitals. That way people are kind of using the same standard protocols to triage their patients. Some of the challenges are upfront investments. This isn't cheap, especially to implement it like in a large city or large hospital network. That would have some high costs, and also adoption resistance from personnel. Doctors and EMTs may be skeptical to kind of rely on AI judgment based off of their own judgment, especially after all the schooling that they went through to be able to, get those jobs. So from a technological domain, there's countless benefits. We can start at like the AI-driven triage. So basically, by using predictive and analytics to like assess patients' injuries, the EMTs can use real-time inputs such as like patient's vitals, blood pressure, I guess like the mechanism of the injury, different things about that would help the AI determine their injury severity. Also, seamless integration. So you can connect the bot to different like EMS monitoring devices, or also connect it to like hospital databases. That way, like the information flows seamlessly throughout those systems. And also, I guess just the AI decision support. So like assisting the paramedics in making like data backed up decisions for patients triages. It can also help relieve like some of the stress that the paramedics are facing in those like high level and high intensity moments on the job. Some different challenges are system reliability. So the bot needs to be able to triage these patients accurately. without providing false positives or negatives, or else the point of the program just, there really isn't a point for it anymore. It's just defeating the purpose. And also, data privacy and security is very essential, and extensive cybersecurity systems necessary, especially working with the hospitals and medical data, making sure that it follows regulations such as HIPAA is crucial to even being allowed to operate. Next, from the organizational domain, I kind of already touched on the standardized protocols, just consistency across triage decisions. It also improves coordination. So, say, the hospital sees this patient coming in, they're high risk, they have enough time to prepare and get everything set up for the patient's arrival, compared to whereas before, they wait for the patient to arrive, kind of assess the situation, and then go on to prepare. It just saves that extra time that might be vital to the patient. And I guess overall, this just leads to greater quality improvement, especially throughout time. The AI can learn from past cases, figure out what went right, what went wrong, and then just kind of base itself off and improve the accuracy of the program. The challenges, there's some heavy training requirements, especially with upfront implementation. The EMS and hospital staff must undergo training to kind of learn the system, learn what it's used for, everything about it. But then as different updates or even new features are added, we'll have to make sure everybody stays up to date on the program. And lastly, stakeholder acceptance. You have to have support and maybe even funding from different hospital administrators and definitely the government officials to even allow the bot to become operational. So the future enhancements, I would focus more on expanding its predictive capabilities. So one way is through enhanced machine learning. So it can take data from past cases and continuously improve. Kind of already touched base on that a little bit, but over time, its data would become way more extensive, and which just leads to greater accuracy. Adaptability, it would be able to take new data and even like new medical practices or medicines or anything along that realm as they become developed over time. And it would be able to learn from those and then take those learnings and implement it into its different data sets. That way, all the recommendations and decisions that the AI generates are current and up to standard times. And then lastly, advanced pattern recognition. So we could use like machine learning to identify complex patterns, whether it's in a medical standpoint or even just like a patient injury standpoint. But these patterns may not be apparent directly to doctors or humans, and the findings may be super important or useful for different medical reasons, but the machine learning's able to generate those a lot quicker than what humans would be able to. So for this, I didn't actually, oh, sorry, we're here. Okay, so we can use these broader applications, the predictive analytics. So we could implement this into patient monitoring. So we could extend predictive analytics to monitor patients' conditions throughout their hospital stay. So we could take the data that it inquires throughout maybe a week's long or stay, and then use that data and pinpoint what was perfect, what needs improved upon, and over time that would help doctors treat cases that are pretty similar to that. And also complication prediction. It might be able to recognize complications that the patient may encounter, alert medical professionals that this could happen, and we would be able to see, it would get prepared for those potential complications, whether to being caught off guard when that happens because a doctor didn't know that was going to happen, but the machine learning might be able to predict that it is going to happen. So here's where I didn't actually generate a complete prototype, but that would be the next step. But you can see this wireframe. It has two different like interfaces. So the top three on the top row are what the EMS would see, and the two on the bottom are for the hospital staff. So basically, the EMS inputs all of the patient's data, everything, and then the AI generates the results, ranks them as low risk, moderate risk, or high risk. If they're high risk, then the EMT sends that to the hospital. The hospital sees that they have an incoming, high risk case. They get those alerts. They click on it. They see everything about the patient. Basically just all the data coming in, and that gives them time to, prepare and set up for this high risk patient that they have coming in. So I guess in conclusion, this bot would offer significant benefits for trauma centers and EMS. It kind of revolutionizes healthcare, especially because that specific area of the trauma center I feel like has been kind of overlooked. I know Dr. Cummings feels the same. She feels that would be very useful to their center and to the different doctors involved in that. So I guess this is just a lesson to try and embrace AI for, healthcare uses. And yeah, I mean, that's all. That's my final project. And thank you. End.